Hello, everyone, and welcome to tonight's presentation all about hair loss. First of all, a little bit of housekeeping. For those of you who are joining live, you are in listen-only mode. So we can't see you, we can't hear you, you are in the comfort of your own homes, and there is a chat feature. So I really want to make this presentation as interactive as possible. It's always a funny feeling when I'm speaking to you and I don't have anybody speaking back. So if you can find that chat bot and you can ask your questions there, I'm happy to answer them as we go, as well as if I don't answer your question, it could be that I just don't see it while you're on here live, and I will do a full Q&A at the end. This presentation is all about hair loss, right? So trying to figure out what the root cause of your hair loss is, and then treating that root cause so of course you can grow your hair back as quickly as possible. When it comes to hair loss, one of the most frustrating experiences for myself was feeling like I wasn't heard. Hair loss was the symptom that I went to continuously to my medical provider asking for assistance with. I was also really tired, but I knew I could push through. I was also seeing weight gain and mood changes, but that I could deal with on my own. What I really wanted was, please just help me fix my hair. And unfortunately, time after time again, I don't know if you've had a similar experience, I felt like my concerns were dismissed, or I felt like they weren't seen as worthy for the conventional medical provider. I was told, just relax, it's probably your stress, it's aging, it's because you're a mom, it's just your hormones, it's totally normal. I had basic testing done, and the bare minimum basic testing, and they said everything was fine. And this is what I commonly see in patients that come to me in my practice. They've had some basic testing done. It's quote unquote normal as per the reference ranges, but they're definitely not optimal for hair growth. So tonight, what we're going to go through is, what should we order when somebody is experiencing hair loss? What are those optimal ranges? And then I will share with you some options and how you can go about getting your own testing done if you're unable to access this through your provider. You're also in the right place if somebody's told you that your hair loss is genetic. There's nothing that you can do. Interestingly enough, in the past, I would say 2 to 3 years, I've seen a substantial rise in my practice of hair loss. And if you are on social media at all and your algorithm is changed to the hair loss route, you will know that there are so many individuals that are dealing with hair loss now. That rise cannot be explained by genetics alone. Genetics, yes, are a factor in many hair loss cases, but not everybody who has the genetic potential to hair loss experiences it. And that's actually really great news, because there's a lot we can do from a diet and lifestyle perspective to help slow down the progression as well as regrow the hair. Other patients have come to me where they've been offered just minoxidil. So if you're in that case where you've been offered minoxidil, or it's genetics, or it's just stress, or there's nothing you can do, or I've been told, it's a good thing that you have a lot of hair. It's not that bad. I don't see anything wrong. So if you can relate to any of those feedbacks or assumptions, or if that sounds familiar to you at all, could you find the chat and just put yes? I would love to see that this chat is actually working and that on my end, I can actually see where your questions are. So if you wouldn't mind me to do that for me, that would be great. The problem with dismissing somebody's hair loss is it doesn't only, the stress of the hair loss isn't just about losing the hair. For me and for many of my patients, the hair loss was one aspect, but then feeling dismissed and feeling like you weren't heard and feeling like you're going a little bit crazy. I was to a point where I was collecting hair in a baggie and I was taking pictures, and I had this folder just to try to prove that what I was experiencing was real. And I want you to know, if you're going through any amount of hair loss, even if you still have a full head of hair, but for you, your hair has thinned and you've noticed it, that's enough for me. I never make my patients justify or show me pictures or anything like that. So if any of this sounds familiar, then you're definitely in the right place, and we're getting a lot of yeses here. So what we're going to be covering tonight is, we're going to go through the basics, what the hair growth cycle is, why hair loss is very rarely just one thing. We're going to talk about female pattern hair loss, or androgenic alopecia. We're going to talk about stress-induced hair loss, or telogen effluvium, and how to distinguish between the two. We're going to touch a tiny little bit on alopecia areata. This is a autoimmune type of hair loss, although this is very specific. It's something that I do treat in my practice, although it deserves its own presentation. We're going to talk about the red flags, what to look out for on scarring alopecia. There are some forms of hair loss that are permanent, so we want to be, mindful that we need to diagnose those quick, as fast as possible to get individuals help because those unfortunately are not reversible if they're far progressed. We're going to talk about lab work, and then we're going to talk about, of course, treatments and what my foundational protocol is. So let's go over the cycle. The chat says disabled. Okay, the chat says disabled. Well, if you have a question, I'm sorry that the chat is disabled. Try to post it in the Q&A. And then that way I'll be able to see it because I do see your Q&A questions. So if you have a question as we go along, post it there. Thank you for letting me know. I am tech support, so tech support will have to do a better job for next time. All right, the hair growth cycle. We essentially have 4 phases of our hair growth. The vast majority of our hairs should be within the growth phase. This is the anagen phase. Now, the anagen phase can last anywhere from 2 to 7 years. So this is why some individuals seem to be able to grow really, really long hair. And other individuals, they find, okay, this is the max that I usually sustain. That part is actually genetic, this anagen phase. Although it can be influenced by nutrition, it can be influenced by stressors, it can be influenced by age as well. And some of our new targeted scalp serums are actually looking at hair longevity, which I'm really excited about. And how can we stimulate more of the hair follicles to stay in the anagen phase? The catagen phase, this is a temporary transitional phase. You should only have 1 to 2% of your hairs in this phase that are on the scalp at one period of time. And then we have the telogen phase or the resting phase. This is 10 to 15% of the hairs. And then of course we have the shedding phase. So this is a normal cycle that our hair follicles are going through, and every hair is in a different phase. When we're looking at a scalp biopsy, essentially what they're looking for, one aspect is what's going on with these phases. And if anything disrupts this normal growth cycle, that's where we see a significant portion of the hair follicles switched into the telogen phase, and we see a lot of shedding. This is where the name telogen effluvium comes from. So telogen effluvium is what we call a stress-induced hair loss, where all of a sudden, out of nowhere, you're seeing clumps of hair fall out in the shower. This is very common after a stressful event. It's common after changes to your hormones, whether you're adding hormones or removing hormones, postpartum or menopause. This is also common in nutritional deficiencies. It's common if you've had a surgery or a viral infection or some sort of inflammation. This is where a significant portion of the hairs go into the telogen phase, and then we see a lot of shedding. Now, one of the things that individuals immediately jump to when they're starting to see their hair fall out is, what am I using, right? They look at all of their shampoos, all of their topicals. What am I doing? The thing with telogen effluvium is when you start to see the stressor, or when you start to see the hair loss, the stressor actually happened 2 to 3 months prior. So for instance, if you started losing your hair in January, the trigger would have to happen in October or November. So you have to look months past. I mention this because when I recommend to patients to start using a different hair product, such as ketoconazole, for instance, they might say, oh my gosh, I use ketoconazole and my hair started falling out. That's not likely to happen. Anything that's causing the hair loss usually happened 2 to 3 months prior. Okay, so I hope that makes sense. What is normal versus what is abnormal hair loss? Normal hair loss is losing about 50 to 100 strands per day. But this is very individualized. So if you used to lose no hair, right, or maybe even just a couple hairs, and then all of a sudden you're losing 50, that to me, even though it's within this normal range, that's enough. Oh, is my screen share paused? Yes, there will be a recording. Can you see my screen? Oh my goodness, this new platform is not what I like. Let's see. You can't see my screen. I think you just see the first phase. All right. I'm sorry, guys. Give me a second here. What about now? Can you see where it says the normal versus abnormal hair loss? Let me go to the Q&A. Sorry about this. Oh, we've got so many responses. Yes, we can see. Okay. All right. Perfect. Thank you. So what is normal versus what is abnormal? Normal is about 50 to 100 hairs a day. But if there is a change from what you were losing before, then that to me is something that we need to investigate. Of course, you're going to lose more hair on wash days. There is going to be expected some seasonal increases in hair loss in the spring and fall. We know that happens. It's normal. It's expected that you would see some hair loss in your brush, your shower, your pillow, but you should not see visible scalp. When it becomes abnormal is when you're experiencing clumps fall out in the shower, there's hair all over the place, your part line's widening, especially around the temples. Maybe you're seeing more of your scalp, your ponytail just seems smaller. This is all areas where you want to pay attention, even if you have a ton of hair. If you start to see more hair loss, you want to investigate it sooner rather than later. And that's the story that a lot of individuals come to me. They say, this is probably going on for over a year, but I didn't think of anything of it because I had so much hair. So any change that's different from your normal, we want to look and investigate. And the reason why I love to look at hair is because hair is a symptom of something going on internally. It is an opportunity for us to look for nutrient deficiencies, issues with your hormones, issues with your thyroid, issues with your blood sugar, inflammation. It's a really important warning sign. And it's often the thing that gets women into the doctor's office. So this is an opportunity because I pushed off all of my other symptoms. I pushed off the mood changes, the fatigue. I'm like, I'll deal with it. I wasn't sleeping as well. I was seeing weight gain. I'm like, but it was my hair that really got me in. So this is something that I take very seriously with my patients, and we always do a thorough investigation. This is a common picture that you will see online about grade 1 through 6 with respect to the amount of hairs. So this is what 10 hairs looks like versus 50 hairs versus 400 hairs. The thing is, depending on the length of your hair, it's going to look different. So what I tell individuals is be very cautious when comparing your hair loss to others' hair loss. I want you to compare to your baseline. What were you losing before versus what are you losing now? Because for somebody, a grade 6, if you have really long hairs, it may not actually be 750 hairs, but this is a guideline with what most people see when they go online. So I would say if it looks anything grade 5 or above, then that's definitely something that we want to take a look at because that's definitely not normal. Now, hair loss is never just one thing. There are usually 8, if not more, root causes that I see, but these are the top ones that I see in my practice. Hormones are a big one. Now, we know that androgenic alopecia or female pattern hair loss is the most common type of hair loss. And unfortunately, what I find is many individuals are just given that diagnosis because it's the most common, it's the easiest to say, and really nobody's looking at their scalp. Nobody's doing a thorough investigation. Nobody's running blood work. No one's doing their genetics. And I actually have seen a number of individuals who are diagnosed with androgenic alopecia or female pattern hair loss when it was something different. It was an iron deficiency or a thyroid issue. So just because it's the most common doesn't mean everybody has it, but it is a common one that I see. Nutrient deficiencies, I look for iron, I look for vitamin D, B12. Protein deficiency is another really big one. So we hear a lot about eat your protein, eat your protein, eat your protein. It is really important when it comes to hair loss. Insulin resistance, there has been a huge rise in insulin resistance. And we're going to talk about how this can contribute to female pattern hair loss. But I believe that this is one of the number one causes for the rise in androgenic alopecia, insulin resistance, which is a blood sugar disorder. Thyroid disorders, I see stress. Gut health is a big one, especially when it comes to scalp health. So if you have any dandruff, seborrheic dermatitis, I often see that connected with a gut infection called Candida that we can pick up using a stool test. Autoimmune types of hair loss. This is where your immune system attacks your hair follicles. And then, of course, there's genetic hair loss as well. So what is female pattern hair loss? What is androgenic alopecia? This is the most common type of hair loss. This is what most individuals just get this diagnosis of, and they're told, use minoxidil. There's nothing you can do. It's long term, and then they're sent on their way. But there is a lot that we can actually do for this hair loss pattern. And the interesting thing is androgenic alopecia will affect about 50% of women by age 50. So it's a significant contributor to hair loss. What we classically see is the part line widening. So if you're noticing that your part is widening, that is a telltale sign. But I've also seen part line widening in iron deficiency. I've also noticed in many cases of androgenic alopecia, the temples are thinning. But again, in iron deficiency or hypothyroidism, we can also see that. So we can't just go by physical appearance alone. That's why I'm so passionate about running the blood work and running the genetic test if we're unsure. Usually with androgenic alopecia, we see diffuse thinning. It's more so at the top. It usually spares along the neckline because the hairs along the neckline do not have the same sensitivity to DHT like the top of the head. We also see a lot of miniaturized hair. So what does this mean? Essentially, in this hair loss pattern, the hair follicles squeeze the hair and they get thinner. You have like more of this look of like those small little baby hairs around here or kind of all throughout the head. That is a telltale sign of androgenic alopecia. Usually, the front of the hairline is preserved. So if you ever notice that your hairline is going back and back and back and back, that is, or it could be a telltale sign of a scarring type of alopecia, and that really does warrant a thorough investigation. Androgenic alopecia does not cause your hairline to recede back in women. This is the most common type of gradual progressive hair loss. So this happens over years and years and years and years. So it's the same thing that you have to go to the gym for months, if not years, to really build up strength and muscle mass. The hair follicles have to be exposed to these androgens for years and years and years and years until all of a sudden it gets to a point where it can no longer tolerate it. The hair starts thinning overall, and it is chronic and progressive, but there's so much we can do to treat it. This is what the classic online pictures will look like for female pattern hair loss or androgenic alopecia, but it doesn't always follow this type 1, type 2, type 3 pattern. The most important thing to do when it comes to hair loss is determine the cause. Is it the androgens? Is it the nutrients? Is it telogen effluvium, stress-induced hair loss? Because if we can figure that out, we have a much better chance of correcting the underlying issue and faster to preserve more hair on the head. It's really hard, if not impossible, to tell if something is androgenic alopecia just by looking at it. So if somebody has just looked at your scalp and gave you this diagnosis, here's what's to take, without running any blood work, I would highly, highly recommend having the blood work done. Here's the difference between female pattern hair loss and male pattern hair loss. Essentially, it's the same hormone that's causing the problem. It just appears a little bit different in male versus female. The key thing to remember is the hairline is maintained in female pattern hair loss. Here's an example of what androgenic alopecia or female pattern hair loss looks like with that part line widening. Now, I've also seen this with iron deficiency. So we have to be really cautious by just looking at the scalp and thinking we know what's going on. So what is female pattern hair loss? Why does it happen? Well, it's a problem with a hormone called DHT. In our bodies, testosterone is converted to DHT by an enzyme. And the speed at which this works, how quickly testosterone goes to DHT, is determined by your genetics. You might have a really fast enzyme and you produce a ton of DHT, and you're more genetically predisposed to hair loss. Or you have a really slow enzyme and you're less likely to produce DHT and you don't experience hair loss. The rate at which the enzyme works is genetics, but we also have this sensitivity, that difference between individuals. So some individuals are very sensitive to DHT and other individuals are not. This is why some individuals can have high levels of DHT on their blood work and they're fine, whereas other individuals can have normal DHT and they're experiencing hair loss. One of the things that is really important is we have to test DHT to know. If your DHT levels are high on blood work, very likely it's androgen alopecia or female pattern hair loss. If they're normal, it doesn't necessarily rule it out because remember, it depends on each individual's genetic sensitivity to it. Why is this DHT becoming more problematic? Insulin resistance plays a huge role in how quickly this turns. So if you really want to ramp up this enzyme and cause more hair loss, develop insulin resistance. Perimenopause is another time. So in perimenopause, your testosterone DHT stays here and your estrogen progesterone goes down. So know the relative difference between these hormones are greater. So we can see this present more in perimenopause. In addition, I see an increased use in hormone replacement therapy. I love hormone replacement therapy. I think it's wonderful. I'm not a huge fan of overdoing testosterone. If you overdo your testosterone levels and you have really, really high levels of testosterone, you're going to have higher levels of DHT. So you can essentially induce androgenic alopecia by over supplementing with testosterone. Maybe you have an increased sensitivity and then we add more testosterone, it becomes a problem. We can test for this. This is actually test for on the Dutch test. It's test for on genetic testing. So I always recommend before megadosing testosterone, although I'm not a huge fan of doing that in general, you really want to know what your 5-alpha reductase enzyme is doing. Now, I touched on insulin resistance. This is the blood sugar disorder that increases androgenic alopecia. Insulin resistance not only will cause hair loss, top of the head, part line widening, it can also cause skin tags, darkening of the skin around the neck, weight gain around the midsection, acne, irregular cycles in females, and it's something that is very prominent in North America. Insulin resistance causes your cholesterol to go up. Insulin resistance causes your liver to not be able to bind up as much testosterone. So now you have more free testosterone going around that can convert to DHT and cause hair loss. So this is something that is really driving androgenic alopecia, and in my opinion is one of the major root causes of why we're seeing more and more female pattern hair loss. Insulin resistance also increases inflammation, it increases oxidative stress, and whenever you have inflammation, the hair follicles are very sensitive to it. If we think back to 2020, particular virus that came in was very inflammatory. And because of the inflammation that was created from this viral infection amongst other viral infections, we saw more hair loss as a subsequent result. So this is something that's really important to treat. We know that only 12% of the North American adult population is metabolically healthy. So this is a huge opportunity for us to say, all right, not only are we going to improve the density, the quality of your hair, not only are we going to stop the hair loss, but we are also treating an underlying metabolic disorder that will significantly improve your quality of life. So hair loss isn't just a cosmetic issue, it's a metabolic issue. And when we treat insulin resistance, we know that we reduce the risk of cardiovascular disease, Alzheimer's, dementia, type 2 diabetes. So this is a really great opportunity for us. And things that I like to target is you want to have your hemoglobin A1C less than 5.5. 5.5 is like the top limit that I want it to be. You want to have your HOMO-IR less than 1.5. You want your fasting insulin ideally less than 6. I have a full guide. You don't have to write all this down. You can have these slides if you want, but I have a full guide on what your optimal levels should be so you can compare to your own blood work. This is why it's so important to run a fasting insulin. This patient here, their hemoglobin A1C, which is the average blood sugar in 3 months, was 5.6. So technically, they're normal. Technically, the doctor would say, your blood sugar is normal, be on your way, but look at their fasting insulin. Their fasting insulin is really, really high. So this tells me the body is working extra hard to keep the blood sugar under control. They don't have diabetes, which is wonderful, but having this high levels of insulin, back to that previous slide, you're going to have more free testosterone to convert to DHT, to irritate the hair follicles, up goes the inflammation, up the oxidative stress, thus we see the hair loss with it. What are the conventional treatments for female pattern hair loss? This is conventionally, okay? So there's most commonly topical minoxidil, 2 or 5%. The 2% is not effective. The women's formula is typically the 2%. You need the 5%. 5% is the only one that's been shown to be effective. Some individuals really like the idea of minoxidil. Some individuals don't like the idea of minoxidil. What I work on for patients in my practice is I want to tell you all of your options. I want to tell you what's going on, what we can optimize, and here's all of your options. Pharmaceutical, benefits, risk, research, natural, same thing. Oral minoxidil, this one is off-label, but it does have some pretty good studies for its efficacy and safety. It is usually easier for individuals to take compared to a topical minoxidil. But with topical minoxidil, the foams are pretty easy. If you're using the liquid, there are little scalp liquid applicators that you can get off of Amazon for a couple bucks that work quite well. I don't want individuals to be afraid of minoxidil. Many individuals don't want to use it. We don't have to use it, but it does really help to improve circulation to the scalp. If you don't want to use minoxidil to help improve circulation, then what you could do is other circulatory stimulants. So you could look at scalp massages, you could look at dermascamping, you could look at lasers and red light therapy, just something to increase the blood flow to the scalp. When we look at spironolactone, finasteride, dutasteride, these are medications that have been shown to either lower DHT or prevent the binding of the testosterone or DHT to the receptor. These do not come without side effects. And again, the best treatment is going to be the one that you feel that you've been given all of the information for. So spironolactone is something that is often prescribed first line. Finasteride, dutasteride, we're a little bit more careful with, especially because there are some concerns with birth defects in menstruating women who are using those. There's also platelet-rich plasma, PRP, hair transplant. There's lots of conventional treatments that we can explore. One, though, that I think is really underrated that's available at a drugstore that you can just go out and purchase is ketoconazole. Ketoconazole is the active component in a dandruff shampoo. Most famously is Nizoral. You can find that on Amazon, Shoppers Drug Mart, CVS, Walgreens. It's very easy to get. Now, ketoconazole is interesting because it can help to reduce the levels of DHT on the scalp, the hormone that causes hair loss, as well as it's anti-inflammatory and can help with the scalp environment. So it helps to reduce yeast on the scalp, inflammation on the scalp. This alone is not going to fix your hair loss, but it could be something to consider because it's so easy just to go out and grab. Ketoconazole, I personally find it's a little bit drying to the ends of my hair. So what I do is I put on an inexpensive oil to the ends. So when my hair is dry, I put on like the OGX oil. Then I go into the shower, I use the ketoconazole, massage it in for 4 minutes, let it sit on the scalp, and then I rinse it out. Of course, the ketoconazole is going to go down to the ends, but the oil that I've put on protects it from that drying effects. This is something that's really easy to do and actually pretty well documented in terms of the research. Now, many of my patients are open to pharmaceutical medications if needed. I have some patients that are like, I want to do the natural treatment, and I am willing to support that as well. There's a lot we can do from a natural perspective, but for a patient who has tried the natural options and it's not working for them, my next step before jumping onto a pharmaceutical is to say, let's run this DNA test. This is the trichogen test where it looks at your DNA just to be sure it is androgenic alopecia that you have. In addition, through this genetics, we can determine whether or not different anti-androgen medications will be effective for you. So for instance, I don't want an individual to use minoxidil if it's going to be like 10% effective. That's a big commitment. One of the biggest complaints that I get with minoxidil is I don't want to have to use something lifelong. With androgenic alopecia, we do have to kind of have that give and take. If anybody says that they can cure it and you never have to take something long term, it's usually not always possible because there is a part of it that is genetic. So before going on a medication, especially a medication that's going to take 6 to 9 months to work, I think that this is a fantastic test just to ensure how likely is each treatment going to be in terms of its efficacy. Now, this is where I really shine because my training is in naturopathic medicine and functional medicine. I usually recommend a first line approach. Treat the root cause. Try to do natural if possible. Use pharmaceuticals if needed when the natural treatment option doesn't work for you. You want to still rule out iron deficiency. Even if it is the hormones that's causing your hair loss, let's fix the iron deficiency. Let's fix vitamin D deficiency and zinc deficiency. We know that zinc deficiency and vitamin D deficiency makes this worse. We know that inflammation makes this worse. We saw this with viral infections too. All of these individuals, all of a sudden, their androgenic alopecia got worse because there's this inflammatory component to it. Treat the insulin resistance. A couple of my favorite things to treat insulin resistance, I love berberine, I love dihydroberberine, I love myo-inositol. These are all easy to get natural products that can help improve the underlying root cause. Rosemary oil, the research on this isn't really great. The research showed that, and many individuals online will quote this, rosemary oil was shown to be as effective as minoxidil. Well, it was shown to be as effective as 2% minoxidil, which we know is not effective. So it's as effective as something that's not effective. I don't think it works really well. And if anything, it's not going to be the only thing to do to fix this underlying hair loss pattern. If you want to use it and you like to use it, if you can do a scalp massage with it, go for it if it works for you. Saw palmetto is another big one. Saw palmetto dosage is at 320 milligrams per day. Pumpkin seed oil, the study wasn't really well done that showed that pumpkin seed oil helped to reduce hair shedding by 40%. If you're going to take pumpkin seed oil, just stick to 1,000 milligrams. I see individuals taking 3,000, 4,000. The study was never on that. It's not necessarily harmful, but I think you're overdoing it. Supplemento has much more research on it. Zinc has much more research on it. Even the studies on pumpkin seed oil, it wasn't just pumpkin seed oil they were using. It also included pygeum and antioxidants in that study. It's not harmful, but I don't think it's going to be the only thing that's going to fix it. But if you wanted to do a combination of supplemento, zinc, treat your vitamin D, treat the insulin resistance, you'll be on track. Protein's also important, regardless of the hair loss type that you have. Protein, protein, protein. Food is always best, but if you have to use an amino acid powder, a collagen powder, a protein powder, in my opinion, it's better to supplement. This is a really important slide just on expectations. Usually for patients that I work with, I don't expect to see the shedding reduce until that 3 to 4 month mark, because it usually takes 3 to 4 months to get the androgen levels under control and the nutrient levels up and resolved. Our bodies are not Amazon Prime, unfortunately, so it's going to take some time. So you've got 3 to 4 months, shedding reduces. Then 4 to 6, you start having, chia pet. I always am a little bit self-conscious of mine in my videos, and I have a whole bunch of different tools to try to keep it under control. 4 to 6 months, new growth appears. 6 to 12 months is where you see significant improvement, and then it's 12 months to 18 months where you really see the maximum results. This is why it's so important to figure out why your hair fell out in the first place. Because if we wait 6 to 12 months for a treatment to work, and it was the wrong treatment, that's a really long time, and that's going to cost you a significant amount of hair. Perimenopause and hair loss. This is one that I commonly see in my practice. This is where androgenic alopecia or even telogen effluvium really shines. In perimenopause, we have this hormone chaos. So our hormones are up and down, up and down, up and down, up and down. It's not this nice gradual decline until our period stops. The problem with having our hormones go erratic is our hair follicles are very sensitive to those changes. So think postpartum, your hair follicles are very sensitive to that drop in estrogen. And in perimenopause, you're up, down, up, down, up, down. The other thing with perimenopause and menopause is androgens, so your DHT, your testosterone, your DHEAs tend to stay here, but the estrogen, progesterone eventually come down here. So now there's this greater distance. Then some individuals will go and get a testosterone pellet because they're fatigued or they want more energy or their libido's low, making this difference even bigger. I'm not a fan of testosterone pellets. I think testosterone replacement therapy is beneficial when used correctly in the right dosages, but you have to be really careful. And I would highly recommend understanding if you are going to use testosterone, how likely is it to be converted to DHT? If it's a really quick conversion, but you love how you feel on testosterone, that's okay. We just need to prevent the testosterone from going to DHT. So that's something that I very commonly see. Somebody starts hormone replacement therapy and then 3 months they're starting to see some hair loss. The thing to keep in mind is perimenopause is not a defining moment in your life. It's a progression and a transition that happens over 7 to 10 years. So this can happen in your late 30s, your early 40s. And this is where estrogen really starts to decline over time. Progesterone, everything dips down. Our DHT sensitivity increases. We see more insulin resistance. We see more dehydration in the hair follicle. One of the common supplements that I think is underutilized in perimenopause is actually omega-3s. So if you found in perimenopause, I'm postpartum breastfeeding, so my estrogen levels are very low. I find dry skin, dry scalp, dry. And that's because estrogen really helps to fight inflammation. It helps with lubrication. So one of the things that is really helpful at this point in time, and I find really helpful, is omega-3s. And that's a great way to help rehydrate the skin and the scalp. Other ways that perimenopause impacts hair loss is your growth phase isn't as long in perimenopause, so your hair doesn't quite get as much time in that growth phase, so it's typically not as long. The sensitivity to DHT goes up. Hormone changes can trigger stress-induced hair loss. Your scalp circulation declines, collagen production declines. So this is where we really need to help with circulation. Think scalp massages, derma stamping, the vortex wand to stimulate blood flow. Anything that helps to increase blood flow to the scalp is really going to be important in perimenopause. I just have one of those scalp massager, inexpensive things from Amazon that I do 4 or 5 minutes before a shower to really help increase circulation. And of course, insulin resistance worsens at this time. Here's everything that you want to check when it comes to hormones and hair loss, especially in perimenopause. You want to understand where your hormones are, but you also want to keep the perspective that just because your hormones might be normal doesn't mean that they're not contributing. And that's where going through your test results with a provider that understands hair loss is going to be really important. Make sure that you're touching on insulin resistance, make sure that your thyroid results are optimal, and still make sure that your nutrient levels are optimal. Again, if you want my guide that shows the optimal levels, I have that all organized, everything that you should run and what the optimal levels are for each. When I address perimenopause related hair loss, we want to address the person as a whole. So, do you need hormone replacement therapy? Do you want to explore hormone replacement therapy? Do you want to try topical or oral minoxidil to help with the circulation aspect to the hair loss? Do you want to try DHT reducing supplements like supplemento, pumpkin seed oil, zinc, pygeum? Do you want to look from a medication perspective? Do you want to run the genetic test to decide which medications would be most appropriate for you? But still, we always need to address iron deficiency, insulin resistance, optimize your vitamin D, etc. Telogen effluvium. So this is our stress-induced hair loss. This type of hair loss is when it comes on suddenly. It happens after a stressor, and think of it like a circuit breaker. It's just boom, hair loss, lots of clumps falling out. Telogen effluvium can become chronic though. If that stressor persists and persists and persists, telogen effluvium can last longer than the 3 to 6 months that is expected. Classic telogen effluvium comes on, it lasts 3 to 6 months, and it resolves on its own. Technically, with classic telogen effluvium, you don't need to do anything. And this is where many individuals are dismissed by their primary care saying, oh, it's just stress, it'll grow back, don't worry about it. But here's the thing, what if it becomes chronic? What if there was something that you could have done to preserve the health of your hair? That was my biggest thing. I just wish I would have known why my hair was falling out sooner because I would have addressed it. Iron deficiency is a big one, thyroid dysfunction, any changes to your hormones, starting birth control, starting hormone replacement therapy, or stopping chronic stress. This is all things that can cause it, a viral infection, inflammation, surgery, etc. This is a slide. I know it's really busy, but I'm going to walk you through this. I really wanted to have a whole slide dedicated to iron deficiency because this is one of the #1 things that I see. I have individuals that have been told that they're normal when their levels are absolutely not optimal for hair growth. You need to have a ferritin of at least 70 for good hair growth. Ferritin tells us how much iron is in storage. How much do you have left for the nice to have things like grow your hair? Your body will go through the storage and go through the storage and go through the storage. Then you become anemic. You don't want to wait until you're anemic before you treat this because that's going to sacrifice your hair. Ferritin needs to be 70 to 100. You want to understand the full picture. And this is where functional medicine really shines. We don't want to know just how much iron's in storage. We need to know how much is in storage, how much is in the blood, how much is moving around the body, and how much is in your red blood cells. So you want a ferritin, a serum iron, a CBC, and this is what I run for everybody. And you have to look at it as a whole picture. Again, ferritin needs to be 70 to 100. It does not matter if your blood test shows green. I've seen a ferritin of 10 green. Ferritin needs to be 70 to 100 for good hair growth. You can not only have hair growth, but you can have fatigue, you can have cravings for ice or dirt, you can have heart palpitations, difficulty breathing, brain fog. And iron deficiency is actually very common in perimenopause because typically in perimenopause, what I see is the periods actually become heavier or the periods become closer together. So anyone who's experiencing hair loss needs to have a full iron panel. How do we treat iron deficiency? There is a really great resource called Hemequity Raise the Bar. This website tells you exactly how to treat iron deficiency. I have other videos on it. You can send me a message. I have a guide. It does not matter which type of iron you take, as long as it's the appropriate amount of elemental iron and you take it long enough and it's tolerated for you. What I recommend is choose one that fits your budget, choose one that you're going to be able to take, and choose one that fits the 60 to 120-ish milligrams of elemental iron. For instance, ferrous fumarate has 100 milligrams of elemental iron per capsule, and it's around $8. That's a one and done easy option for individuals. If that hurts your stomach, you might have to go to something like a heme iron, but just make sure that you take enough of it to get the appropriate amount of elemental iron. The guidelines are to treat iron deficiency with oral iron for 3 months, and if it does not increase the ferritin, so you need to repeat it. If it does not increase the ferritin, then we need to look for absorption issues, celiac, we need to offer an iron infusion. If you're not being offered those things, then that's problematic. Your provider is not following the guidelines. So start with oral iron, make sure that you're taking enough of it. Yes, there's things that can help you absorb iron, like taking it away from caffeine, away from dairy, taking it with vitamin C. Some individuals need lactoferrin. This is something that you really want to work with somebody who can help you resolve this, because it can be resolved, and it can be resolved quite easily once you get on the right treatment. Let's talk about thyroid. So this is another one that I thought deserved its own slide. Thyroid is so much more than just a TSH, and thyroid also has optimal levels. One of the biggest things that really drove my attention to thyroid is the fact that when I was looking at my hormones for pregnancy, right? I have teenagers and now I have a 6-month-old. I wanted to make sure that my levels were optimal because I was well aware that my age was going to be a contributing factor, perhaps, to a difficulty in conceiving. So one of the things I looked at is TSH, and fertility doctors want your TSH less than 2.5. So why isn't everybody who is potentially of childbearing age not to that same standard? Many labs go up to 4, up to 10. You want your TSH less than 2.5. You also want to have enough free T3. Free T3 is really important. I like to see it above 3.6. The other key piece is you should not have any thyroid antibodies. Thyroid antibodies means your immune system's attacking your thyroid gland. That is not normal. So when I look at thyroid for patients, I run the TSH, the free T3, free T4, reverse T3, and the thyroid antibodies. This is really important to have a look at. I was suffering with thyroid symptoms and I was told I was normal, until I ran the full thyroid panel. My antibodies were through the roof. And there are things that we can do to reduce thyroid antibodies. It doesn't guarantee that your thyroid would never become a problem later. It doesn't guarantee that your symptoms will go away, but many individuals do symptomatically feel better when it's treated. So treating telogen effluvium or stress-induced hair loss. The good news is once we find that stressor, we can very easily resolve this. So priority number one needs to find the trigger and remove it so it doesn't become chronic, address the underlying issues. If you are low in protein, if you're low in calories, if you've lost too much weight too quickly, we also need to address that. In my opinion, GLP-1 medications do not directly cause weight loss, although there is some evidence that perhaps tirzepatide could be problematic, although with the semaglutides, we don't see it. And I don't see it in my patients who are using low dosages and they're losing weight gradually. Also, any big shift in your diet can trigger hair loss. So what I tell individuals, if you're starting a GLP-1 medication, go slowly. Really, really keep the dose low. I know it's exciting to lose weight. Slow and slow if you want to preserve your hair. I usually see it in individuals who have lost more than 15 to 20 pounds, especially if that happened within the first 3 months. So be very, very careful with that. If you're using a low dose, it's gradual, healthy weight loss, and you're getting enough protein, I really don't see it as a contributing factor. If anything, those GLP-1 medications are treating the insulin resistance, so the female pattern hair loss should get a lot better. Step number 2, whether you've went through telogen effluvium or androgenic alopecia, obviously you want your hair to grow back as quickly as possible. So make sure that you're eating 100 to 130 grams of protein a day. And I have found really good success in supplementing with amino acids. Now, these products, these ones are ones that I sell. You do not have to purchase my product. It does support my brand, so I can continue to do free education like this. But any amino acid product, it's going to be the same. You want to look for things like lysine because that helps with iron absorption. It helps build the hair follicle. But really, an amino acid This has been one of my hero products to prevent stress-induced hair loss. Obviously, I'm postpartum. I have lost hair, but I still maintained a decent amount of hair, and I really attribute this to my daily 2 scoops of the amino plus the whole beauty collagen. Whole beauty collagen contains something called lustreva, and lustreva has been shown to help improve hair density as well. CHOSA is another really great one. This is the ingredient that's in my liquid gold. This helps with collagen production. It helps stimulate the hair follicles, helps with hair, skin, and nails. The liquid gold doesn't taste good. Many individuals really don't like that. I can appreciate it doesn't taste good. There's now capsules available. You guys have been asking for that for a long period of time. I'm not a big fan of capsules. I feel like I already take so many capsules, but you guys wanted something because you didn't like the taste of the liquid gold. So now it's available in capsules. If it's still showing on my website, it's still available, but we're pretty close to selling those out. Also, make sure that you're sleeping and timeline to expect. Make sure that you are giving it enough time, right? So full recovery might take 6 to 18 months, depending on what's going on. But if you are going through a stress-induced hair loss, get rid of the stressor, fix the nutrient deficiency. Amino, whole beauty collagen, liquid gold are like my trio to make sure your hair grows quicker. Alopecia areata, this is an autoimmune type of hair loss. This is one that I do see and I do treat in my practice, but it's not as common. This is where you're seeing circle bald patches of hair loss. This is where the immune system is attacking the hair follicles. It can resolve on its own spontaneously in a lot of cases, but we do know that it tends to relapse. About 85% of the cases of alopecia areata do come back. So this is something where a significant portion of our immune system is in the gut. So my recommendation is always to run a GI map stool test, see what's going on in the gut microbiome. You want to look for things like H. pylori, leaky gut, or intestinal hyperpermeability. You want to make sure that you're on an anti-inflammatory diet. You want to optimize your zinc and vitamin D, and then make sure that you don't have any other autoimmune conditions. So make sure you don't have Hashimoto's, celiac, lupus, because alopecia areata rarely travels alone. Usually it comes with multiple things. Scarring alopecia, I just wanted to touch on this really quickly because we want to make sure that we are keeping an eye out for those red flags. There are certain types of hair loss that are permanent. So the good news with the ones we talked about, telogen effluvium, androgenic alopecia, alopecia areata, we have treatments for that. We can help support you, whether it's natural or pharmaceutical or a combination. But these scarring alopecias can become permanent. We can stop their progression, but that's why it's so important that we pick it up early so that we can stop it. If you see any sort of hairline receding, like your forehead's getting larger, 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 that's a problem. You also want to look for whether or not the areas where you're missing hair looks really shiny. So if there's no follicles there, it looks really shiny, it's getting progressively worse, you want to see a dermatologist for that. If you're experiencing itching, burning, or scalp pain, you need to investigate that. Although telogen effluvium and alopecia or androgenic alopecia, sometimes individuals can experience scalp burning and scalp pain as well. Same with Candida infections on the scalp or Malassezia yeast infections on the scalp. That can cause some itching and burning. But if you have any of these, you need to have an assessment done and ideally have a scalp biopsy done to make sure that there's no sort of scarring alopecia. Don't wait. Again, the thing that I hear time and time again from my patients who've been diagnosed with scarring alopecia is, I wish I just caught it sooner. I wish I would have known. Lab work, normal versus optimal. Again, this is normal versus optimal. So make sure you have this testing done. You can screenshot this, but don't worry. You can always just ask me for my optimal ranges. I have a full guide that I can send you over. What is my foundational hair nutritional support protocol? Again, we've reviewed this. I want to drill it into your head. Make sure that you have enough iron, you have enough zinc, you have enough vitamin D, and you have enough protein. If any of these are low, it's going to be problematic. This is something that I test for. Test, don't guess. Instead of taking 20 different supplements, figure out what's deficient for you from your blood work, from your genetic test, and just supplement smartly. Again, I really like the amino, the liquid gold, and the lustrevia. While you're looking for answers, it can feel defeating, like you just want to do something, right? With my postpartum hair loss, I knew I was going to lose some hair postpartum, but I just wanted to do whatever I could to mitigate that. So this is what I did. This is what I recommend to individuals. These are things that are very safe. You can get started right away. If you look at these ingredients, CHOSA is the ingredient in my liquid gold. If you want to support my brand, purchase mine. If you don't, there are other companies. Just Google CHOSA. You'll find other companies that carry that ingredient. Same with the Lustrevia. I like the Designs for Health Whole Beauty Collagen. In Canada, it's called HSN Beauty Collagen, I think. I'll look that up. If you're a Canadian and you want to know the exact name, I can let you know. But Lustrevia is a trademarked ingredient. So if you want to Amazon or Google Lustrevia, you'll be able to find one that works for you. In terms of the last thing, these are natural topical serums. This was a question that I was getting asked over and over again. Is there anything natural that I can use as an alternative to minoxidil? Anything that you do topically is not going to fix the underlying root issue. So anything that you do topically, you are going to have to continue to do day after day after day. My question to individuals who ask me, I need a natural option, my question would be, if you're willing to do something topically and you're willing to continue to do it long term, there's no harm in doing these natural options, but just know that our research really isn't there. For instance, minoxidil has been shown to increase hair density by 20 to 40% in about 6 months. Redensil, this would be the one that I feel has the most evidence to support it, only increases the density about 10%. There's Capixul, which has some anti-inflammatory effects, maybe some 5-alpha reductase effects. There's Procapsul, which helps to stimulate scalp circulation. There's a peptide in it. There are some serums available on Amazon. Minimalist is one of them. They take Redensil, Capixul, Procapsul, and put it into one serum. So if I was going to use a natural serum and I didn't want to use minoxidil, I would get a serum that had the Redensil, Capixul, Procapsul in it. But just know the research isn't quite there to support it, as well as the research that we do have available is from the manufacturer. So if you want to use it, great. I think ketoconazole is one to consider. There's some new work on scalp longevity, hair longevity coming out from OneSkin, the OS01 peptide. That has some emerging promising data. And I think the verdict is really out on these topical products. I think they're worth a shot, but really, as you can probably hear with my hesitation, my recommendation is always to find the root cause. And once we establish what those root causes in, we can find a much better treatment for you. Here's the comparison of the three most common types of hair loss that I see. Female pattern hair loss, androgenic alopecia, that's genetics, DHT issue, insulin resistance, and perimenopause, we see that. Just because there's a genetic component, though, doesn't mean that we can't treat it. Part line widening around the temples. Usually the neckline is fine. Conventional treatments, natural treatments, regrowth timeline. I think this is a really great summary slide. I don't want to take any more time away from your questions, though. This is something that you can screenshot and kind of look at. This is kind of everything that I am thinking when I see a new patient, trying to differentiate which one that we have. Key takeaways is blood work is everything. Triggers, find your cause. If you don't have the cause down, you're going to be wasting time, you're going to be wasting money, and you're going to lose more hair. Normal labs is not the same as optimal when it comes to hair loss. The hair grows slowly, right? 1 centimeter a month. So you have to commit to at least 6 months. My recommendations to patients that I see is let's do the initial appointment. We decide what blood work to run. Some individuals have already done the hair loss blood work bundle and they bring that to me on the first visit. That's fine too. Then we look at initiating a treatment, and I want to see you every 2.5 to 3 months. I want to continue to follow up on your blood work if there's something that we're tracking, and I want to see you every 2 to 3 months to make sure that we are on the right track and we change the plan if we need to. Always address the root cause and then stimulate regrowth at the same time. So yes, I love my liquid gold. Yes, I love the Lustreva. I love the aminoline, but those are things to help regrow the hair faster. They don't treat the root cause. You can use them, but you have to use them at the same time as treating the root cause. There was a really great question. It's like, what if the liquid gold doesn't work for me? The liquid gold is never meant to treat hair loss. It's meant to help regrow your hair thicker and faster. We have to look for the root cause to treat the loss. Early intervention matters. Miniaturized hair can recover. If your follicles have already scarred over, they cannot. So it's really important to make sure we're diagnosing scarring alopecia as quickly as possible. This is what I do with patients in my practice. I hope that gave you an idea of how I practice, what I look for, the blood work that I order, the comprehensive tests that I order. If you're wanting to have some assistance, you can set up an initial appointment with me. We take a look at your labs or we order labs and we go through everything from an optimal perspective. Something that I'm really passionate about is helping you understand what's going on. A lot of my patients are really numbers oriented. They want to find the root cause. They like to know what their blood work says, and that's something that I really like to do as well. You will never find me just saying, "Oh, your labs are fine. Your labs are normal." I want you to understand what each things mean. All right, I'm going to go to the Q&A because I want to make sure that I leave enough time to get your questions answered. There will be a recording. So this has been recorded. It says if everything works out and I can get it downloaded, I will send everybody a recording. So that's fine. Okay, questions here. Where can we access the guide? If you send me a message, just send me a message on any of my social medias. My social medias are always at Brianne Callanan, or you can send me an email. If you get a hold of me and just say, I want the optimal lab guide, I will send that over. What should we do to reduce thyroid antibodies? So there's a number of things that have been shown to be helpful. Treating insulin resistance, selenium perhaps has been shown to be helpful as well, and minoxidil. Now, the study on 4 grams of minoxidil and 200 micrograms of selenium, that was shown to reduce thyroid antibodies after 6 months. So it's really important to understand the timeline because if we initiate a treatment and then we run the blood work 2 months later and your thyroid antibodies have not come down, that doesn't necessarily mean that it's not working. In addition, I have a full YouTube video on this. There does seem to be a connection between the gut microbiome, where 80% of our immune system is, and thyroid antibodies. So if you have infections like SIBO, Candida, H. pylori, that also can contribute to elevations in thyroid antibodies. So often in autoimmune cases, Hashimoto's, lupus, IBD, I'm looking at a GI map stool test and an organic acid test. I'm taking an iron that has 30 milligrams. Will this help if my ferritin level is 50? So ferritin levels of 50, I actually usually don't see shedding at that point in time. Once the ferritin is above 40 to 50, in my experience, shedding really does slow down. 70 to 100 is where hair growth happens. So if you're seeing a lot of shedding and your ferritin is 50, it may or may not be that. You might have to look for some other causes. If you are taking 30 milligrams, the research on iron deficiency, and this is from the American Academy of Family Physicians, 30 milligrams is not enough to raise ferritin levels. I'm hesitant to give dosing recommendations on an online platform like this because iron isn't always safe and you can take too much iron and you may need cofactors like zinc. You might need copper with it. So 30, to answer your question, is probably not enough to raise your ferritin levels. You can always start with 30 and repeat your labs in 3 months, but it's likely not enough and you want to work with somebody to get to your ideal dose. Okay, this is a great question. What are the optimal levels for postmenopausal women on HRT? So for HRT, the recommendations and guidelines is we go based off of symptoms, not based off of blood work. We know that all dosages of our transdermal estrogen, so the patch or the estrogel, we know that all dosages have been shown to help with bone protection. We normally go based off of symptoms. So if you are feeling good and you don't have any hot flashes or night sweats and your brain fog's gone and you're sleeping well, those are all really great signs that your dosages is enough. Some individuals, if we go up too high, they have different effects from it. So we really have to play around and figure out what's right for you. The exception is testosterone. I would highly recommend keeping your testosterone in the normal physiological ranges for a female, just because it's not proven to be unsafe to have high levels of testosterone doesn't mean that we should be doing it. And I have seen it cause a lot of acne, hair growth on the face, hair loss on the head. So I would always be cautious with that. Why do some people have baby hairs for their entire lives? So that's a great question. It could be that you're losing hair in cycles. So you could have this chronic telogen effluvium where your hair just grows and then it's lost. But also, baby hairs, that's what miniaturized hairs look like. So we have to determine, is this baby hairs, new hair growth, and then they just fall out? Or is it actually the influence of hormones and DHT? This is a great question. Can nutritional deficiencies also cause hair miniaturization? Yes. So just because we're seeing miniaturized hair does not necessarily mean it's DHT. It can also be zinc and vitamin D deficiency. So it's very complex. I wish there was a way that we could just scan an individual and say, boom, this is what you have, but we don't have that yet. What we have to do is we have to take a thorough history. My initial visit's like an hour that I'll sit with an individual, getting to know them, asking them questions, going through past labs. I often run comprehensive blood work. So if you don't already have blood work done, we'll get you the hair loss blood work bundle. We'll check for all of the nutrient deficiencies. Other things like copper, vitamin A, zinc. We'll run a genetic test if we're unsure, called the trichogen test. I had a patient the other day where their genetic test showed that they're more genetically predisposed to be low in vitamin E. And vitamin E is not one that I commonly run on blood work because I commonly don't see it deficient. Lo and behold, she's deficient in vitamin E, which plays a role in hair loss. It plays a role in bone health. There's some studies on annatto-E or delta tocotrienols for certain types of cancers, lowering cholesterol. So that was really interesting to me. I was recently diagnosed with Hashimoto's. I noticed a large amount of hair loss 2 to 3 weeks after a bad flare. I get a bad flare every few months. It feels kind of hopeless. Does Hashimoto's have to be in remission to see reductions in hair loss? This one is individualized. So I have some patients where as long as their free T3 levels are optimal, their hair is good. And I would say that's the vast majority of individuals. You don't have to have no thyroid antibodies to get your hair to grow back with Hashimoto's. I have some patients where their thyroid antibodies never change. And we've tried and we've looked at the gut health. They've maybe even tried low-dose naltrexone. They tried all of the things and their thyroid antibodies stay the exact same, and that's okay. As long as you optimize your free T3 and you don't have other things like iron deficiency, you don't have inflammation, you don't have insulin resistance, then the hair can make a full recovery. What if DHT labs are normal, but DHEA sulfate is high? So there's so many different types of androgens. There's dihydrotestosterone, there's DHEA, there's testosterone, there's androstenedione. Any of these, when they're higher, can contribute to hair loss. Wow, this individual's was experiencing hair loss and their ferritin came back at a level of 3. Would I need to stop exercising while trying to regrow my hair? So heavy endurance exercise or just doing lots of exercise in general does use up your iron, but you shouldn't have to stop exercising to fix your iron deficiency. If you get on a really good oral iron, you focus on diet, you make sure that you're not deficient in other things that could be contributing. If your ferritin's that low, you might want to look at why. Are you not eating enough iron? Are you having heavy menstrual cycles? Are your cycles like short together? Are you not absorbing? What's going on in the gut health? Do you have celiac? Do you have SIBO? Do you have H. pylori? All of those things really are important. Can you take the amino-lean liquid gold and collagen at the same time? Yes. So that's what I do every single day. I fill up my Stanley. I do 2 scoops of the amino-lean, 1 scoop of the whole beauty collagen, and then I put the liquid gold in it. But the liquid gold, if you really hate it, as long as you dilute it in something, I don't find it's that bad. But if you really don't like it, I understand it's now available in the capsules. How does regrowth look after chronic TE? Should the strands be thick or do they start off thin? They should be the same thickness. If you are noticing that your hair density, each individual strand is not as thick, the CHOSA, which is in the liquid gold, does a really good job with that. Also making sure that you have enough collagen in your, like collagen, amino acids, protein in your diet, like the building blocks of the hair is really important. And no, they should come in equally as thick. So if not, maybe you need to look at nutrition, protein, CHOSA, the Lustreva, amino acids. Those are all things to consider. I've been diagnosed with androgenic alopecia. Can I take Supplemento if I have low DHA, low testosterone, and low free testosterone and normal DHT? So that's an interesting one. So if your blood work is showing everything is low, then you may have something else going on, or you may have an increased sensitivity to those androgens. In that case, where it sounds like it might not be androgenic alopecia, you might want to consider the genetic test just to make sure. The trichogen test will look at how quick that enzyme is. And then if the test comes back, yes, you do have a really fast enzyme, you have an increased sensitivity. And then the test will show you the percent likelihood of supplemental being effective, spironolactone, finasteride, dutasteride. I think it's important to know before you start something. You can definitely take it, but I would want to look at that a little bit further. I'm currently on 0.5 testosterone, 1 milligram estrogen cream, still cycling, and not on progesterone. So that's an interesting one. Typically, we wouldn't recommend using estrogen without progesterone. So that would be something to follow up back with your prescribing provider. Even if you have a cycle, usually you should be on both. And definitely, any shifts in the hormones can contribute to hair loss. If the stressor must be systemic for TE, could cold plunges? Oh, I've seen this one. Yes. So one of the things that we know with telogen effluvium or stress-induced hair loss is seasonal changes can cause more hair loss. So spring and fall, we would expect to see some more hair loss, and that's completely normal. Now, having cold plunges, I don't think we have any, we definitely don't have any research that would show that that would be negative for the hair follicles. If anything, if you're going back and forth with hot and cold on the scalp, I would assume that that would stimulate hair growth because you're increasing circulation. So I don't think that that would be a problem for you, but also I don't think that's ever been studied. What iron doesn't cause constipation? So I find that constipation due to iron is usually because it's not being taken properly. If you take it with 1,000 milligrams of vitamin C, I usually don't find that it causes an issue for individuals. Magnesium citrate is a great one to add at a different time to deal with any sort of constipation. If it's really problematic for you, you might want to consider a heme iron or an iron bisglycinate. The liposomal iron is fine as well. I just find the cost for the milligrams that you get per serving is quite high. So I would be more apt because I do think of costs and I do think of just feasibility. It doesn't seem quite feasible to me to take. I see people on 8 to 10 capsules of heme iron, and I'm like, go for it if you can do that. But for me, I just really don't like swallowing that many pills. So I would go with perhaps something like an iron bisglycinate. Ferrochal is what it's called. Designs for Health has one. There's a liquid one that's 100 milligrams of elemental iron in the form of iron bisglycinate called Wow Liquid online. There's lots that you could consider, but if you want to do liposomal iron, you can. Is there a supplement to help with circulation? Yeah, definitely. So arginine, caffeine, ginkgo biloba. And if you do have an issue with circulation, the trichogen genetic test can tell you that. And then it'll tell you which option is going to be best. But of course, like scalp massages, microneedling, red light therapy, frequency wands, that all can increase circulation as well. I am currently pregnant. I've been told that my hair should be better during pregnancy. Is there a way to prevent hair loss after pregnancy? So we have to appreciate that there's going to be some level of hair loss postpartum. And it doesn't matter if you have the most stress-free labor and delivery, your hormones are going to change and there's going to be a drop in, of course, blood loss. So what I would suggest is towards the end of your pregnancy, check on your ferritin levels and make sure that they're not optimal. Make sure that they are optimal. And if not, many providers are offering iron infusions like in pregnancy to prevent iron deficiency postpartum. We know that iron infusions actually reduce the risk of postpartum anxiety and depression because low iron is a contributing factor. And then I drink a lot of the aminoline. I make sure my protein levels are up. I try to sleep the best of my ability. Aminoline, the liquid gold, and the whole beauty collagen could help. Couple more here. If you have a red inflamed scalp and insulin resistance, hair loss. So if you have a red inflamed scalp, I would look at ketoconazole. You could try apple cider vinegar rinses as well. A cup of apple cider vinegar with a cup of water, put it on the scalp as a rinse. That will help reduce melasthesia levels on the scalp, which can cause redness and inflammation, as well as treating the insulin resistance. That's going to be a huge factor for you. Oftentimes in inflamed scalp, sebderm, any sort of like eczema, acne, sebderm, acne infections, or even lumps and bumps in the scalp, a GI map stool test and organic acid test can be quite helpful. This is another question here about menopause, no HRT, Hashimoto's, thyroidectomy 2 years ago. Interestingly enough, what I find for patients who have had their thyroid removed is it's a lot easier to control the dose of the medication. We can keep your levels much more stable because we don't have the influence of your own thyroid gland. So that's a positive thing. If your recent blood work has shown increased testosterone, what you would want to do is exactly that. If you have increased testosterone, see if you have insulin resistance and do we need to treat that? In addition, if you have increased testosterone, that will contribute to hair loss. So you might want to look at your zinc levels, saw palmetto, pygeum, nettles, cranberry is a great antioxidant. Beta sterols are a great antioxidant. I I really don't like to come on here for an educational webinar and promote my own products. But if you're looking for a DHT inhibitor, I have the DHT blocker. It contains all of those things, but you don't have to use mine. Just go back to that slide where it talked about the dosaging. My products are third-party tested. They're formulated by me, so I think that they're really great, but there's a lot of really great supplements that are out there as well. So yeah, you could consider the supplemento, the pumpkin seed oil, pygeum, all of those things that help to inhibit DHT. Or if it's significant, you may want to talk to your doctor about the spironolactone, finasteride, dutasteride. If you're overwhelmed and you need support, set up an appointment. We'll go through it together so we can help clarify things. I'm from New Zealand. Hello, welcome from New Zealand. How can you tell if the new hair is coming in as miniaturized? That is a great question. So seeing somebody in person that can really look at the scalp or scalp biopsy is really one of the only ways that we can take a look. Now, what I do through the camera is I look for where I'm seeing the hair loss. So if I'm seeing the part line widening, that's a clue towards androgenic alopecia. If I'm seeing the temples, that could be iron deficiency, thyroid, or androgenic alopecia. Then really what I'm doing is I'm looking at your genetic test and I'm looking at your blood work. So we need to combine those three things before we make a decision on what it is and what we need to treat. Have tried microneedling treatments and laser, topical minoxidil, but not seeing any improvement. So with the dermastamp and the microneedling and the frequency and the red light therapy, all of those things you have to use consistently and you have to use them for at least 6 months. Now, usually on their own, they're not enough to fully resolve the hair loss. When minoxidil is not working, again, coming back to that trichogen test, that's a really interesting one because some individuals can't convert minoxidil to minoxidil sulfate, the active form. So for some individuals, it doesn't work as well. The trichogen test is really great because we can say, are you going to respond or not? Before you make a lifelong commitment to doing something, even if it doesn't take that long for you, the genetic test I think is great. You also would want to run blood work. Maybe we're missing something. Maybe you also have an iron deficiency. Anything that increases circulation to the scalp, whether it's minoxidil, your dermastamping, if you don't have good quality nutrients that are being delivered, you can stimulate the scalp as much as you want. If you don't have, the building blocks, that's still going to be problematic. The trichogen test, I have to order it for you, or you have to have a provider order it. If you send me a message, no problem. I will help get that over. You just need somebody to sign for it. So we offer that in my practice. I can order it for you ahead of time, and then we can set up an appointment to review your results and blood work that you have at a follow-up. That's all the questions, and we were pretty good for time. Normally I do go over. I'm sure there are more questions that individuals have. If you think of anything, just let me know. If you want to set up an appointment, send me over a message. You can contact my clinic. There's my website, my TikTok, my social media. Everything is there. I really do try to answer as many questions that I can. I do try to interact with as many people on social media as well. And if you want support, feel free to reach out, set up an appointment. I'm happy to point you in the right direction. Again, my role is not to tell you what to take or what to do, just give you all of the information so that you can really feel that you're making an educated choice, whether that's minoxidil, whether that's a serum, whether that's a pharmaceutical or supplemental. There's so many options that we can use to improve your hair growth and improve your hair loss. So don't lose hope. There's definitely treatments out there, and there's providers that will take you seriously. So if you have hair loss, get a thorough investigation, and I hope that was helpful, and I will see you guys later.